Howdy everyone, Matt and Mateo here, coming at you with another orthopedic special test, and this one is for the cervical spine. It is the cervical flexion rotation test. From what I could find, this test came from a book in 1994 by Brian Stratton. It is called Dysfunction, Evaluation and Treatment of the Cervical Spine and Thoracic Inlet. Now this test looks at the very top of the upper cervical and it's assessing the amount of rotation that goes on there. And it's very often used with people who have a upper cervical dysfunction or with cervicogenic headaches. So to perform this test, you have the patient lying in the supine position. Now I'm going to show a video of me doing it here in just a moment, but I'll explain it first. Mateo's a little stiff. But what you want to do is that you want to fully flex the cervical spine, and then you're going to rotate to one side and then toward the opposite side. What you are looking for are a couple things. One, a loss of movement. One paper did say that normal rotation is about 44 degrees, so anything under 32 or less could be considered a positive, or you get a firm in range, or a production of pain symptoms. And what you see here is that I am really good going into one direction, but if I go to the other direction, I am limited. So I actually have a bit of an upper cervical dysfunction myself. When it comes to the research for this test, there is very good sensitivity and specificity for it. And most of the research happens to be in people with cervicogenic headaches. So the people who have cervicogenic headaches will typically be positive with this test. So there's a couple papers that have found that. So there you go. That is the cervical flexion rotation test. Let me know, do you use this test? Do you like this test? You know, do you use it for something else outside of upper cervical, like cervicogenic headaches? Let us know down in the comments. And as always, take care of yourself. Take care of your patients. We'll see you next time.